July is Minority Mental Health Awareness Month, and as with many health indicators, minority communities face unique challenges in dealing with mental illness. Access to care is one key reason, but there are others, as Taelyr Jackson joins us now to explain. Taylor.
That's right, Rich. People from racial and ethnic minority groups face many obstacles when it comes to accessing mental health care. I spoke with two organizations that are working to bridge that disparity gap for Oklahomans. According to the Substance Abuse and Mental Health Service Administration, Hispanic, Asian, and African American adults with mental illnesses are less likely to receive mental health services than white adults.
I believe that it's important that we highlight people of color when it comes to mental health because we are an underserved community. We're underrepresented as well when it comes to health care.
Organizations and nonprofits around the U.S. are taking steps to bring more assistance to people of color. In Oklahoma, the Mental Health Association Oklahoma and the Joshua Harvey Outreach are recognizing Minority Mental Health Awareness Month.
So I think it's very important that we get the word out there. We talk about how important our mental health is, and we get those issues addressed.
Lack of access and cultural differences play a role in why people of color don't receive mental health services.
I think access to care is a big issue. I also believe that it's a cultural thing. I think that sometimes admitting that you need help is a sign of weakness, and I think that a lot of times we've grown up hearing those narratives. So I think it's very important that we change the narrative within the community.
Social worker Shetra Snowball says mistrust is also a problem in the community.
Another issue is there's a great deal of mistrust from the Black community in people in power positions. They don't trust the police. They don't trust the teacher at the school because they're scared they're going to call in a child welfare referral on them. They don't trust the person at the corner store. They don't want the neighbor in their business.
Mental Health Association Oklahoma offers multiple services to assist those in need of mental health services. Program Manager Lindsay Israel says employees are trained to be sensitive to community needs.
I believe that we are very inclusive. I believe that that is a big issue. I think that we need to be not just reflective of the communities that we serve, but we also need to be culturally sensitive of the communities that we serve. And I know with our organization, there's a lot of trainings when it comes to cultural sensitivity. They push a lot of that and trying to be educated about the different cultures and communities that we serve.
Cultural awareness and mental health training is something Roma Presley says may have helped save her son's life.
I think that it would be good for them to have more training on mental health services because it's a lot of them that don't know, and now they have the COPE teams to come out and help them when they have the breakdowns, but they need to make it more accessible because sometimes they only operate 8 hours out of a day, but mental health is 24 hours a day, people that need help.
On August 24, 2018, Presley's son, Joshua Harvey, suffered from a mental health crisis in downtown Tulsa.
Well, my son Joshua, he was a really outgoing, lovable person, and he had ran into some different life changes where he had mental issues and substance abuse at the same time. And in the midst of all of this, he had a mental breakdown and he was killed in Tulsa.
An altercation with Tulsa police resulted in Harvey being tased more than 20 times within a 3-minute period.
Tulsa police had tased him 27 times, which automatically just shut him down. But at the time, they wasn't aware of the mental status that he was in to, get him the appropriate help that he needed.
Harvey died 3 days later. Presley says this led to the creation of the Joshua Harvey Foundation.
So I felt that I needed to reach out to the community because I know there's a lot of more people with mental health issues and substance abuse. And a lot of times the people, they try to medicate the mental health with drugs and not get the right help, and then it causes other problems. They get addicted to the drugs.
The foundation helps connect rural and minority communities with mental health resources.
Our purpose right now is to make people aware of the mental health and substance abuse problems that is faced in the community. And by getting out, we go out to the community and we give them information about the different things that's available, where they can go to the mental health facilities in Muskogee, Tulsa, Wagner, all around.
Snowball thinks the state should consider investing more into mental health services.
When they cut mentoring services through the Medicaid program, or they're cutting mental health services, and they're increasing prison services and paying more for the prisons and y'all paying for the mental health, we need mental health services in schools. My daughter has just recently joined a nonprofit and started working for a nonprofit that they are fighting to get counseling in Star Spencer High School in Oklahoma City, because we went back and looked, and there was like a fight every single day, and that stresses children out and it increases their anxiety.
Snowball says mental health services should be offered in multiple environments like schools and jobs, because she says at some point everyone needs help.
Pretty much everything that, we on the news focus on, all the robbing and killing and shooting, and it's even the officers and the people in those positions of power suffer from mental health issues. How many of these stories that have been out when an officer has hurt somebody and said, "I was afraid"? That's a form of anxiety. They don't know how to manage it.
Snowball and Israel want people to know that it's okay to reach out for help or speak up if you see a loved one needs help.
Make somebody aware, because when you suffer in silence, nobody knows and they can help you. So the biggest step is to find somebody that you feel safe talking to, and then reach out to that person and say, "Hey, I need some help."
Don't be afraid to have the conversation. Don't be afraid to speak up and speak out and let them know, "Hey, I notice it seems that you're suffering," and give them a non-judgmental ear and just listen.
If you're in need of mental health services, you can call the 988 hotline or contact a mental health professional for help.